Hello and welcome to our Health Talk series. Today we have Gail Carmody, who is a life and business coach for doctors and other healthcare professionals. Welcome, Gail, to our series.
Thank you, Rita. Thank you so much for inviting me on.
You're welcome.
It's exciting to be part of it and also part of the journey of ONUS as well. It's really exciting.
Thank you for that. Gail, why don't you tell us a little bit of your story of how you got into this and where you started?
Okay, Rita. Well, I started many years ago. I don't actually like to say the number. But,
none of us do.
Many years ago, I started as a registered nurse. And that was here in Sydney, Australia at St Vincent's Hospital, which was an excellent place to train in the day. And then I quickly moved up the ranks into, once I finished my training, into management positions. I always had a desire to be in management positions. I quickly moved into private health, and I took on a number of roles, from Deputy Director of Nursing to Director of Nursing to CEO, for many years across many private hospitals. And these roles were very, very pressured. They took a lot of my time. There was a lot of expectations, not only by the organisation, but by the doctors and patients and staff, etc. And after gaining that experience, I then decided to move into business development for hospitals. And I did this across a couple of really large groups because I've always had a very strong interest in business. And so I did that across a couple of very large groups. One was a private sector. Then I moved across to St Vincent's and Mater Health, which was a joined group, and they're both public and private. So it was a very, very, very big role, but very exciting because it was about planning and making changes and developing new business and introducing new specialties and all that was involved in the planning behind. So with all that experience across hospitals, I actually, one step before that, I then moved from there into medical consulting across Asia, Australia, Asia, and the Middle East.
So you actually travelled to those locations, did you?
I travelled and I lived there.
Fantastic.
Yeah, I lived there as well, which was exciting. Yeah, it was very, culturally, it was very good for me to develop my knowledge firsthand on how people, doctors particularly, and healthcare workers operated in each different country, and just the different cultures and expectations by patients and just the general public. It was a very good experience. I thoroughly enjoyed it. And they're a different environment to Australia. They're a lot more outgoing. They're a lot more about relationships and things like that, which taught me another aspect on my whole career. So this was also a really demanding role. Every role I've had has been very demanding with time and expectations. And I thought, after a period of time, I thought, look, maybe I should think about semi-retiring. But because I've always had really busy roles, it was sort of hard to think even how I would semi-retire. Plus, I'd looked at my lifestyle. I worked long hours. I was actually away from my family. It created a big challenge for a relationship with my family, particularly my daughter. Wow. I lost a lot of time with my family. It actually cost me my marriage. And it actually cost me a lot of money because with, investments and money tied up in a marriage, it created a lot of problems, and I lost a lot of money through that as well. But money wasn't my issue, really. It was just that loss of the relationships. And I didn't realise how, and a lot of people are in the situation where they're in very pressured jobs, how that would take such a major toll on my family life and on me too personally, actually, at the end of the day.
Yeah,
so
it's been very hard for you to deal with all of that whilst in a high pressure job as well.
Yeah, well, the thing is, Rita, and probably with a lot of other people, I didn't actually realise the toll it was taking. I was so actually with taking all the roles on, I was always looking really for fulfilment was looking for something else all the time. That's why I kept taking on different roles. And the more pressure, the better. The more I enjoyed it. Plus, amongst this, I did 2 additional degrees.
My God, superwoman.
Yeah, that was even more insane, really. But anyway, I did 2 degrees. And during that whole time, it was a matter of me sort of seeking every time I took on a new role, I thought, this is it. This is exciting. This will make me feel fulfilled. And then to a lot of people that knew me, they thought, oh, what a life she's got, traveling. She lives overseas. She's got all these great jobs, thinking that was the ultimate life.
Yes, yes.
When really inside, I was just seeking something else, some fulfillment, some sort of other happiness. So I started to reflect on all this, particularly when my marriage fell apart and my daughter was a teenager at the time, and our relationship was just so difficult. And I'm thinking, life shouldn't be like this. And so I started looking into personal development. I just fell upon it, actually. I didn't purposely seek it. I fell upon it. And it was just so exciting to have all this new learning about our brains and our subconscious and the way we work and the way we have relationships with others and how we're responsible.
That's a big one, isn't it?
Yeah.
How we're responsible.
I know. It just opened my eyes. And then I just couldn't get enough of learning about it. And also, I realised during all this learning that all the years I'd worked with doctors, and it was the same with doctors over internationally as well as Australia, how difficult their lives are and how stressful and how unsatisfied so many of them were. And there was very little support because they were supposed to be heroic and, have all the knowledge and help people, and that was their role, and a lot of them suffered personally with their marriages. And there's actually a high suicide rate with doctors. And I started reflecting on that and thinking, well, maybe there's some way I can help others. I can help them. And that's what drove me to the path of focusing on coaching for doctors and other healthcare workers, because I've worked with all of them at different levels, in different roles. Many of them coming into my office and, having a breakdown, and they just couldn't talk to anyone. There was no avenue for them to talk and find relief and find answers. And so that's what actually drove me, not only my own personal development, but I learned how much that helped me. I thought, well, this is going to help doctors. And I thought that's the path I'm going to take. And so that's what actually is how I come about becoming a coach for doctors.
So definitely from your own personal experience, you've actually found that niche, because you've seen what's happened with doctors who are usually suffer from so much burnout and the old problem of the emotional wheel, that we may be fulfilled in our career, but then we're empty in other sectors of our life. And it's that old adage where every segment needs to be fulfilled for you not to be searching for something. That's usually what brings people to personal development, isn't it? When they're feeling lost, when certain segments of their life are feeling empty. So, I mean, it's fantastic you were in that position to actually see where doctors needed support.
But I think too, Rita, the interesting thing was that I actually had all that experience from my angle, where I didn't even realise all those, like you're talking about that wheel of life. I thought that just being full with work, that was the answer. I thought that was all I needed.
So many people do that.
All the other segments were empty, and that's why the wheel wasn't actually going around,
Yes.
So I saw that in me, and that's when I started then to reflect on the healthcare workers and particularly doctors I'd worked with and how they'd suffered so many, I'd seen so many suffering. And so I thought, well, here am I at that stage now, I should be giving back. So that's why I started coaching.
That's great. That's great. And how do you feel that your particular style of coaching, is it different to someone, like if someone from the public, just the general public, like someone like me, for example, if I came to you for a session, is your style of coaching being developed? Have you developed it specifically to help doctors, or is it a type of coaching that's flexible amongst everyone?
I think it's flexible amongst everyone, and I always refer to my style of counselling, not counselling, coaching, because coaching and counselling are two different things. Actually,
yeah.
As being liquid, liquid, being able to fit into whatever's required, because there's no one fits all.
That's
Everyone's
right.
different. Everyone have different issues. Everyone perceives things differently. So I could also coach the public. But why I've focused on doctors is because I have a really solid understanding of what their needs are. And I can really talk their talk. Right. Because I know, I've been in the field, I've been in health for so many years, worked with doctors in developing their businesses and, worked with them all closely. So I understand them, and I understand where they're coming from and what their fears are and why they have those fears and why they're anxious.
Right. And do you find that a lot of their concerns are from a personal perspective, or do they always go from a work perspective? Like, are their fears work-based, or are their fears more in their personal life? Or what do you feel? Because whenever we go to a doctor, we always feel like, as a patient, you go to a doctor and you think they're here to help me, but no one ever really stops to think that coaches, counselors, doctors, that they have their concerns and their emotional issues as well. So yeah, is that's
very true. I find that because our life and our work crosses over,
yes,
that it can't be separated. But with doctors, because they've trained so many years and spent so much time in the system, in so many hours, that they look at things from work and they don't realise how that influences home.
That's what I was
So that's
thinking,
a big thing that I try and give them strategies on, is getting some sort of balance and realigning, so it can help them become more of a whole person rather than just totally work related.
Yeah. And how do you find how receptive are they to being coached? I mean, most doctors don't normally go into the coaching or the complementary or the alternative fields. How receptive are they to accepting your work or taking up your offers for coaching?
Well, I think things are changing a little bit, and I think particularly because of COVID as well, people are realising that they actually do need some sort of help because of all those external pressures that have been out of their control. And a lot of them are realising that they do need help. And so people that come to me only come because they realise there's an issue. If you try and push coaching onto someone, it doesn't work anyway.
No.
Someone has to be seeking help and seeking a coach for it to be effective and work for them. So I only have people that come to me for help, and there's a lot more people realising that they need it.
Yes. Yeah, that's fantastic. And what sort of modalities do you incorporate? Is there anything about your coaching that's different? Because you call yourself, a life and business coach. What sort of modalities have you incorporated into your coaching, and does that make your style, unique? Is there anything different about yours?
I think, Rita, I based my coaching a lot on NLP, neuro-linguistic programming, because I think language in our subconscious is where everything starts.
It is.
So I use a lot of that, and I learnt coaching techniques in different styles, but I think the most important thing is you have to actually individually tailor it to each doctor. So some people might have, adapt better to NLP techniques, and others have it through general coaching. But I find that the most important thing about coaching is I have to ask the right question.
Yeah,
it's the question.
It's the question,
and it's the quality of questions. So the purpose of my questions are to elicit the correct information that's going to help that person resolve their issues. So, and with my coaching as well, it's always starting from now into the future. We do talk a little bit on the first session about what's happened in the past, but dwelling on the past isn't going to resolve anything. It's taking action from this point and making a plan into the future.
So yours is more about forward thinking, forward focus, or solution focused outcomes, as opposed to rehashing everything that's happened from the past.
In the past, yeah.
Yeah.
So there's one interesting thing that it actually comes from NLP is that most of the issues we take forward in life happen before we're 7 years of age. So I do go through prior from 0 to 7 with people, but I don't go from 7 years to whatever their current age is, because it's already a reflection of what's happened before they were 7. So to change any of that is for them to acknowledge what's happened, or they have to actually discover it, really. They discover it and acknowledge it, and then that allows them to move forward from today or whenever they start their coaching. So that's why there's not a lot of reason to dwell on those other interim years, because it's already just a rehash of what's happened in the past. Right.
Do you find that a lot of people like to sit in that area? Do you find it sometimes it's hard to motivate people out of that area? Because, you know, it is hard when we've had emotional problems not to sit in the pity pit, you know, like, in that sort of area where they don't realize it. Absolutely no judgment, because people don't realize that they're actually sitting in that, you know, so they're sitting in that little pity camp sort of thing. So how do you sort of deal with people who feel resistant to sort of not sit there and get them moving?
Well, my approach is, and I'm quite clear about this in the first couple of sessions, is that we need to move forward from this point, and that the client needs to take action to change what they're feeling from the past. Obviously, we can't ignore our emotions, and our emotions come up every day. So we need to be aware of them. The biggest thing is awareness. Yes. Awareness. Be aware, and don't sit in the past. Look forward to the future and how to change it. So you have to acknowledge your emotions and your feelings. They can't be just ignored. Exactly. And I think that's actually been a problem or an issue with many healthcare workers and doctors, because we've learnt to block
everything out.
A lot of emotion, because so many tragic things happen, and you see so many tragic things, you can't be carrying that beyond that initial time you've seen it or dealt with it.
Yes.
So they learn to block it, and so in that way they're not actually dealing with their emotions. They learn to block but not deal.
Yeah, exactly. Yeah. And I think that's true for everyone. You know, it's a human protection response in a way, isn't it?
Yeah.
Without giving away anything personal or anything like that. But I think a lot of people would be curious, because everyone goes to the doctor and feels like the doctor has all the answers. What would be have you noticed are like the biggest challenges that doctors face when you speak to them? Is it the frustration with the healthcare system? Is it frustrated with too many hours at work? Is it what's their biggest challenge in a way?
So this is a really easy one to answer, Rita, actually, and not give any details away. I found it's actually been the most common things across everyone I've coached. All those other things you're talking about are background things like the system, like having to work within the system and the pressures of the system. But number one is time management.
Right.
And we always discover in the journey that there are areas they can take control of and manage better than what they anticipated. And would you believe confidence?
Confidence.
Self Self-confidence.
I wouldn't have thought that one.
No, I was finding that difficult too, but self-confidence. That's a major one. And overwhelm and anxiety. Yeah. And that, I mean, we say burnout, but they're actually all the things that add up to burnout. You know, the combination of all those things adds up to the burnout bit.
Absolutely.
So that's sort of the end. Yeah, and a lot of issues they can't control, like working within the system and how the system goes. Actually, a couple of things there is if they are in the system, it's often the expectations and a little bit of bullying by seniors, which is just a learned behaviour within the system. But it's recognising that and how to set strategies up is what helps individuals. But they're all the common things. And even internationally, I've got some international clients and it's a similar thing.
It's amazing that no one is free from that bullying in the workplace, are they? It's like in every sector. I mean, it's quite amazing. You think in something like healthcare and doctors, you know, like they're all about healing or healing and looking after people. Yeah. That then naturally the mentoring would be sort of like very supportive. But there's that. I mean, we never get rid of the ego, though, do we? So it's a lot of that there. It doesn't matter where it goes. The ego doesn't matter what sector you're in. The ego will cloud everything.
Yeah, I think that's one of the main problems.
Is it?
And I think it's to learned behaviours, and then that becomes an expectation. That's how you behave. I think the system creates it. So how you deal with the system, which is big. I mean, obviously, the ideal would be you'd start at the bottom and educate everyone so it all filtered up. A lot of public health systems are actually trying to solve some of this by starting at the top, but they're people that have already learned the behaviours for so many years. It's so hard to make change, and they're not coming into that learning willingly. It's an expectation. So if you don't come in willingly, you don't actually make the change. Exactly. But I think it'd be great for something to be taught in medical school or nursing school or whatever the other health professionals are, so that it starts, so they develop their confidence and strategies to deal with the workplace and not be bullies and be accepting and deal with their anxiety. So if it started, that's my great thing is I really would love it to start at the bottom with education, and then see it come up through the system.
Well, I suppose if you're going to change a culture, the culture has to start from the roots up, not from the top down. Everything grows upwards sort of thing. Yeah. So that brings me to my other question. What would you find would be one of your greatest challenges in your field, either in your field dealing with the public or dealing with doctors in particular? What are some of your greatest challenges in working as a healthcare coach?
I think really reflecting on what I've just said previously is making a bigger difference in the overall system. Like I'm dealing with a few, individual doctors, and that's helping them develop strategies in developing confidence and being a better person in the workplace and having more balance home and work. But having some effect on the overall system is what I find a challenge. Whether it's starting at the Ministry of Health, whether it's starting in universities, that's my bigger vision of how change could happen for the better.
Yep, absolutely. So you said, so you were saying that so that doctors have anxiety. Would you feel that the anxiety is actually higher in the young ones coming up, in the interns, like the ones leaving university, coming into hospitals, et cetera, that their anxiety is higher than the established doctors, or is it all the way through?
It's basically all the way through, but I think the younger generation are more willing to acknowledge that's how they feel. Whereas
they are starting to tap into their and not be fearful, especially male, the male gender, which have been always taught to hide their feelings, that the younger generation are really starting to accept that it is actually okay to tap into your emotions. So that's what you're finding.
Yeah, the younger ones are more willing to actually talk about it. And acknowledge it, whereas the older ones are still in that old school frame of mind where, they've got to be tough and they can't talk about it. It means they're weak, or they're not a good doctor, or, why should they need help type of thing. So, but that's where I think the bullying starts, because that's how they deal with their anxiety, rather than talking about it. So they're the oldest set up here, and so they've come up through all those pressures, and so they project. Whereas the younger ones are more willing to actually say, hey, look, this life's pretty tough. I'm not dealing with this so well. This isn't what I expected medicine to be. You know?
Yeah.
So they come from all these years of study in academia and suddenly come into this system and workforce that they haven't been in. Many of them haven't actually worked either. So they've got to adjust to all this work, expectations of patients, expectations of staff, expectations of their seniors, and then of the whole system. And that's what creates a lot of the anxiety and pressure for them.
Right. It's not easy work for them, is it? It's certainly not a career to go into lightheartedly.
Unfortunately, no. And people don't realise that they spend so many years, and nearly 40, before they actually earn decent money. And yet, if you're a plumber or an electrician, a tradie, you can be already earning big money by the time you're 19 or 20. And these doctors are nearly 40 and studied for 100 years, still studying, fighting their way in, and they're at that age before they can earn some money. But talking about that side of it, as I said before, my great interest is business too, in health. And I've helped many doctors establish their practices, and that's why I do both life and business. And that also ties in with, as I said, many people come through academia and into the workforce, and when they're finished in their training in the hospitals, they're often faced with then setting up a business, like a medical practice, which is business.
Or when they go out on their own. Yes.
Or into partnership. And so they've had no financial or business training, and all of a sudden they're expected to run a business. So that's why I do the business side of it as well, so I can support them in setting up practice and how they run it and getting them started.
That's an amazing package you offer. So you offer to help them set up their business, and then you also offer the emotional support that they will need whilst they're in that business, and as they've gone further down the track, when they may have gone into overwhelm or burnout.
Exactly. So I guess that's, Rita, the great thing about my long history and experience in health, because I've had both aspects, but even from starting as a registered nurse, I always had that great interest of business.
Yes.
And that's why I went into managing hospitals really early in my career.
Yeah.
And that's why I moved to doing the business development side of it, and then medical consulting. The medical consulting was basically helping doctors set up businesses or hospitals developing new services internationally.
Right.
So I always had a very strong interest in the business side of health.
And do you feel that people take up your service, like the business coaching side? Are they quite receptive to that?
They find it a little bit unusual because they're not used to asking for help.
Yes, they're used to helping everyone else, not helping themselves.
They're not that used to asking for help. But once they realise how much I can help them, they're happy to accept it and be guided.
Right.
But obviously they play a big part in the decision making. It's just that I guide them.
Yes.
So I guess as a coach, you can play many roles. You can be a mentor or a guide or a coach. It's whatever the client actually needs. So on the business side, it's often a mentor and a guide that I play the role of.
Right. That's fantastic. So to wrap up today, if someone was thinking about, even someone in healthcare listening to this, or anyone in the public was a bit nervous about coming to a coach or a life coach or a business coach, or what are some of the things that you could say to them to help reassure them that, you know, everyone has come from a place of having issues, even coaches, everyone. And as we've heard today, even doctors, you know, they may have all the medical answers, but they have their own issues as well. So what are some of the things, because I think that's one of the problems, that people actually come to a coach thinking that a coach never has problems, that they've never had any life issues, that they've always had it together, you know, and that's why they've gone into the field. But most have gone into the field because of their life story. So what are some of the things that you could let someone know to encourage them to take that step to get help?
I think, Rita, one example is I continually have coaching.
Oh, you do yourself. I continually
have coaching. I do for me, because it helps me give more to my clients. It helps me continue in developing my business. It gives me other colleagues I can toss ideas around with. But most of all, it's continuing for me to develop and me to be able to then give back to clients. The other good thing about coaching is a little bit off that question you asked, but their learning never ends. Like, as a coach, I have to continually read, and that's why I have coaching. I do many masterclasses, many sessions with a variety of people, because it's a continuous learning path. But as far as other people taking up coaching, I didn't realise how valuable it was until I became a coach, and how valuable it is to me as a person having continuous coaching. And it just helps you remain centred, continue with self-development, be able to deal with life, and all the issues that continuously come up. And I always say to clients, if they're not sure about coaching, just have one session with me. And if they think we're not a good fit, or they don't think it's going to help, then they don't continue. And I haven't had anyone that hasn't continued.
That's fantastic. That's a good rate.
Yeah. So I think people can try. It's not like, oh, you're suddenly committed and you have to do it forever. I think it's always worthwhile to try one session and see how you go, and see how it changes your thought process, and go that way. So I think it's always worthwhile trying. And as I said, I've always had coaches, and will continue to do so.
Well, I think that's the main point, though, isn't it, Gail? That people find it so acceptable to have a business coach, like for their business, not necessarily just in healthcare, but in any business.
Yeah, that's correct.
But people haven't yet caught on that to be successful in business, you need to be successful with yourself. And it's like, and life coaching is actually an ongoing thing. It isn't I've had coaching for this amount of time, or I've had therapy for this amount of time, I've made it now. You know, I'm okay. Life is always going to be throwing you those curveballs. You know, it's how you actually respond to those curveballs. And sometimes life can get a bit heavy, and we do need sometimes to empty out, or to have a different perspective. So
learn strategies as well, to develop,
learn those strategies,
how you deal with it.
So life coaching should, well, not sure, but it would be great if people learned that life coaching is actually an ongoing process, not just a one-off process. So,
and it doesn't mean that there's something wrong with you.
That's the fear, though, isn't it?
Yeah, that you'll be judged because you're having coaching. It's just a matter of making you just a better person for you, basically, for yourself and for your family and loved ones. But mostly it's to help you personally maximise your life and happiness. So that's what it's really about.
Absolutely. And I think that what you touched on about the stigma around having coaching, I think that's quite cultural. So because some countries there is no issue around it, it's quite normal to have it, but other countries, you know, there's still that I'm not seen as coping, or I'm not seen as doing well, or weak, we have this fear of vulnerability in a way, haven't we?
That's true. Very true.
Yes.
But I like to give the analogy, Rita, of professional sports people.
Right.
Tiger Woods, tennis players, do they just play on their own? They never, ever are without a coach.
That's true.
Ever, ever.
That's right.
So they don't say, I'm the best, I'm fine, I can manage, I don't need a coach. They have a coach all the time.
That's right.
Even though they're top in their game. So I think that's a good analogy to show how important coaching is.
It is. And not only do they have their coach as their mentor and their sports coach, you get all those top end sports people, and they have an emotional, mental coach, they have a mind coach,
Yeah, very much so. Yeah.
You have to. You want to be top of your game. You actually need mind coaching as well. So
exactly.
You're in a good field, Gail, and it's very much needed.
I'm really enjoying giving back to people and seeing the difference it makes in people.
Yes.
How they just become aware of what changes they can make themselves to make their lives better.
Yeah.
It's all simple. You don't need anything except yourself to do it.
That's right. And I think once people start, they realise, and then they usually go, why didn't I start earlier?
Exactly.
Once they break that barrier of actually coming to see someone. And I think it's actually amazing that you work with doctors, because apart from you, I don't know anyone else who does actually do coaching with doctors.
There's a couple of other people, but they probably have an organisational approach rather than an individual approach. And as I said before, with an organisational approach, it's often a mandatory thing they have to do, so change doesn't happen.
Yes.
So when I do individuals, they're the ones seeking it, so that's when they're able to change. So that's why I like it on an individual basis.
Absolutely.
Rather than an organisation. Yeah.
I think the work you do is brilliant. I think it's much needed. And I think, the better the doctor feels, the better care the patient gets. So
much.
Yes.
And much better. Very much so. Yeah.
No, it's great. Thank you for coming on today, Gail.
Well, thank you, Rita, very much. And I'd just like to make a comment about the platform you're working with, ONUS.
Yes.
I'm excited to be part of that. It's going to certainly be a big thing in the future, joining the healthcare professional and the client. And so there'll be a lot more access to people like me through that sort of media from even the general public.
That's right.
It's all about that rounded approach to healthcare. So I think that you've done very well in establishing that and working with it.
Thank you, Gail. I appreciate that.
And
everyone, you can connect with Gail. Please come over to the ONUS app, download the app and connect with Gail. She's there. You can book through, you can phone her, email her, check out her website and any posts that she's put on. And Gail, it's been fantastic having you on the show.
Thank you very much.